Thank you, Sarah. My name's Greg Smith. I'm with Health Price Partners, which is a Colorado nonprofit. We were formed with the idea of, is there a way to improve the functions of markets in healthcare? With the idea or the hope that that would reduce cost, and the further hope that if cost is reduced, that improves access. So we're trying to benefit the state in that way. My background is consumer products. Other members of our team are former healthcare executives in both the for-profit and nonprofit provider area. So that's what we are and what we're trying to do. Next slide, please. Okay, before we really get started, let's look at the landscape of markets in healthcare and do a little bit of orientation. The Affordable Care Act of 2010 had a provision in it that required healthcare prices, the government could require healthcare prices to be disclosed. And in 2019, regulations came out requiring those disclosures. And there have been several sets of regulations since, continuing up through this year. So this is an active area where the government is increasingly requiring disclosure. The idea here behind these disclosures is that more data will facilitate markets, and that will help consumers. But as the young woman on the left of this picture shows, there are some obstacles. The data is somewhat incomplete, and the prices are not binding. And a major issue, which we'll touch on later in the presentation, is right now health insurance plans, which is how most people probably get health insurance, don't offer a benefit if you price shop. And so the question on the table is, can we take this landscape and try to improve things so that consumers can compare prices and save money? Next slide. What we're going to do in our presentation here is we're going to talk a little bit about free markets in healthcare in general terms, try to reference some data in doing that, and then we'll talk about ways to fix the system. But we think it's important to talk for a minute about markets in healthcare, because many people in the United States feel that we do have a market-based system. And we think the answer to that is, in some ways, we sort of do, but in significant other ways, not really. And why is that? Let's dig there a little bit. The major issues in getting a free market to operate in healthcare is there are a couple factors that are they're baked into the healthcare system that insulate it somewhat, not completely, but somewhat from market dynamics. Big one is demand. You know, when something breaks, it has to be fixed. You don't have an option, oh, gee, I need this very expensive procedure. You can't delay it. That's also that that you don't control demand works both ways on the supply and demand equation, because if demand is static, it's what the economists call inflexible, or inelastic rather. It's inelastic to price. You don't see hospitals running, a special on heart surgery or hip replacement, because that is just not the nature of the demand. So that means there's no price reduction to encourage demand, but there's also not really a penalty for price increases because the demand is fixed. And that's a dynamic that has to be addressed if you want to get a market running. Major one is the presence of intermediaries. Again, this is endemic to our system. It is a feature of the system. We have diagnosing intermediaries, physicians, who determine what you need. And then we have financial intermediaries, also called insurance companies, which tend to insulate patients from some costs, hopefully the major costs, by charging them a premium for that insurance. But that takes the patient a step away from the transaction in terms of ability to control cost and also motivation to control cost. Insurance companies do want to get costs down, but they're not as motivated as an individual patient might be. Next slide, please. A quick recap of how markets actually work at a consumer level. This slide shows the actual ways that markets try to influence price. On the left side of this little chart is a list of major expenses for a household. We're looking throughout this presentation, we're looking at healthcare from the perspective of a consumer. And these are the major costs: housing, transportation, and healthcare is kind of in the middle at 14%. Across the top of the chart are the major strategies that are used by consumers to control cost. And you can look at those and you can see them in your daily life. You can compare prices. You can negotiate prices. You can sometimes substitute things, and so on and so forth. Most of those categories of spending that a consumer encounters are susceptible to one or more of those strategies, not healthcare. The big strategy, and arguably the only strategy in many cases for a consumer to control healthcare costs, is by decreasing quantity. In other words, you forego care. And the data on this is extensive and very solid that yes, in fact, many consumers of healthcare do forego care. And they're subject for another presentation, but we are lacking in healthcare really good tools for consumers to control their prices. So that's what we're trying to address here. Next slide. We've looked at a lot of data as part of our analysis, and because of our time limitations, we didn't want to make this a data-heavy presentation. But here is some data that I think is interesting. What you're looking at here is one procedure that we think is representative, cesarean section birth. It has some features, in some cases, the timing of that can be controlled. The facility of that can be controlled by the consumer, not in all cases. There are many other procedures that are expensive. Knee replacement is another, many, many others. What the dots each represent what Cigna, which we just picked them as an insurer, what they would pay for this procedure at various hospitals in Colorado. Each dot represents basically a hospital. At the bottom of this chart, there's dollars. On the left side, the leftmost dot is about $3,500. There is a hospital in Colorado that will do this procedure, and they quote it officially: we will do this, or for Cigna, at $3,500. On the far right side of the chart, the lowest dot out there is $27,000. And everything else falls in between. The point of this chart is to show same insurance, same procedure, but look at the variation. This variation means, among other things, there's something driving variation in these prices. And we think to a large extent that it's a lack of market dynamics. There are other forces that are driving these prices. And as I say, this is a separate subject, and I'm not trying to beat up on Cigna or anybody here or hospitals for paying different rates. The point is, this is the landscape we're facing. There's great price variability. And one of the reasons it's variable, we're pretty sure, is that markets are constrained in operating in healthcare. Next slide. Flipping through my notes here. Okay, now we get to the part of the presentation where we talk about, okay, what do we do about this? We've talked about markets, how they work, in some areas, but in a lot of significant ways, they don't work well. We really dug in with CIVHC's help in terms of Colorado spending. And we found a couple of things that to us were very interesting. The average out-of-pocket spend for a person who's incurring healthcare costs, some people have no spending in a year. They're young, healthy, usually both or often both. But when they do spend, it's $1,400 per person on average. And we looked at that and said, aha, this is worth digging more, because for most families, this is a significant expense. So there's something to be worked with here in terms of trying to save money. Looking at very broad data sets. And if you look at that data and you say, well, what if you could somehow shop these prices? For Colorado, we sampled to a 25 to 40% savings if you could possibly shop. This is consistent with many other studies academically that show savings up to 40%. So we feel at this point we verified this is worth looking at. And before we get into sort of where we think the savings might come from, a little bit of data to talk about, because we try to let data guide our choices and where we do our investigation. There is good, solid consumer research out there that where consumers say, yeah, if I could shop, I would. If it got my costs down, I would do that. And it's 89%. And in, retail dynamics, that's significant. That gets your attention. The consumers would like to shop for care, but the obstacles that we talked of earlier in the presentation, the data is incomplete, it's somewhat complex, it can be confusing, is preventing consumers. And then just kind of an aside, we think Colorado is a really good place to maybe try something for all the reasons listed. We have civic, we have healthcare policy and financing. They have some excellent price comparison data on their website, and the state is very healthy. Next slide. Okay, so here we come to what do we do? Our best, and we're working on this. We do not have this equation solved, but we think there's probably an app that needs to be built. Recent advances in artificial intelligence may make it less expensive to build a powerful app than it was as recently as a few years ago. Our best guess, mainly in outpatient, is that if you could robustly price shop procedures in Colorado, you might be able to save consumers $100 million per year. But there are two really big challenges. To do this, the tool has got to be easy. And this is where a little bit of my background comes into play with consumer behaviors. There's a limit to how much time people have and how much learning curve they're willing to invest. And probably as big or bigger is we have to do something that we call within Health Price Partners a way to break the financial insurance intermediary barrier. We call it the intermediary barrier. What is that? Right now, using my earlier example, if I have Cigna for my insurance and I work really hard and find a lower price for a Cigna procedure at a hospital, there is no incentive for me to do that. I don't get a break on my insurance. I don't get a price benefit to myself. And so we have to really look hard at that. And that's where our focus is right now. So I'm done. If anyone has any questions, I'll be happy to try to answer them.
That was so great. Thank you so much. We do have one question in the chat from Kat, who asks, how does price transparency help consumers when we are at the mercy of our providers' participation in certain network hospitals?
The answer at the moment is it does not help you, and for exactly that reason. And again, we're not beating up on any part of the industry here, but there's a structure in healthcare that makes it, there's no reason that you should shop for price if you have insurance generally. And we have got to find a way to pierce that system, or we're not going to be able to save money for people. At the moment, you're absolutely right.
Yeah. And not seeing any other questions immediately. And I do want to keep us moving along, but that was a great presentation, Greg. Thank you so much.
Thank you.
I will put his email in the chat as well here in just a second. Feel free to follow up if you have any other questions that come to mind. So I will go ahead.